Chairman and members of the Medical Trust Fund Task Force, distinguished partners from the private sector, colleagues, members of parliament and ministers, our friends from the media, distinguished ladies and gentlemen, all protocols. Permit me to welcome you all to the official launch of the Ghana Medical Trust Fund, also known as the Mahama Case Initiative. This marks yet another groundbreaking intervention from the government of His Excellency John Dramani Mahama, reflecting his deep empathy for individuals grappling with the burden of chronic non-communicable diseases in Ghana. You may recall that the establishment of the Ghana Medical Trust Fund was a key promise made by the then candidate, His Excellency John, people-centered and compassionate healthcare reform. Your Excellency, ladies and gentlemen, available estimates from the World Health Organization indicate that non-communicable diseases remain the leading global health challenge, responsible for 75% of non-pandemic related deaths worldwide in 2021. The WHO further reports that low and middle income countries continue to bear NCDs account for approximately 43% of all-cause mortality, with a significant rise recorded between 2012 and 2023. Today, they rank among the top 10 causes of death. Alarmingly, individuals aged between 18 and 45, the most productive segment of our population, constitute over 50% of the NCD cases, impacting both public health and economic productivity. Facility-based data from our 3 teaching hospitals show that the average annual treatment cost for NCDs is approximately 53,000 Ghana cedis per patient. This financial burden severely strains households, with over 60% of affected families facing catastrophic health expenditures. Furthermore, individuals diagnosed with chronic diseases have a 75% likelihood of falling into poverty within 5 years. Those battling kidney and cardiovascular diseases in particular spend between 70 to 95% of their total non-food expenditure on healthcare, a clear indication of the devastating economic toll. Such a situation poses serious risks to public health and demands urgent attention. It must not be ignored. Swift and decisive action is crucial to mitigate its impact and safeguard the well-being of our communities. The Ghana Medical Trust Fund, the Mahama Case Initiative, offers a transformative opportunity to protect lives, preserve dignity, and strengthen our health system. A recent survey involving over 3,300 Ghanaians reflected strong public endorsement of the fund. 79% of respondents deemed it necessary, and more than half expressed willingness to contribute monthly. The overall objective of the fund is to mobilize resources to finance and support the treatment of non-communicable diseases. It focuses on covering the cost of treating chronic conditions, including cancers, diabetes, hypertension-related complications, cardiology issues, chronic kidney failure, and stroke at the specialist level. Support will be selective, targeting the gaps not currently covered by the National Health Insurance. In addition, capacity building initiatives are being pursued to expand access to specialist care with a strong emphasis on early screening and diagnosis. As a ministry, we reaffirm our unwavering commitment to achieving universal health coverage for the people of Ghana. The Ghana Medical Trust Fund aligns strategically with our key sectorial policy frameworks, including the National Health Policy 2020, Ghana's Roadmap for Attaining Universal Health Coverage 2020 to 2023, 2020 to 2030, the Essential Health Services Package 2022 to 2030, and the National Policy on Non-Communicable Disease 2022. We pledge to ensure the full implementation of this visionary initiative, enabling the people of Ghana to reap its maximum benefit under the inspiring leadership of His Excellency John Dramani Mahama. Ladies and gentlemen, today also marks the achievement of 3 major milestones in the establishment of the Ghana Medical Trust Fund. First and foremost, the task force inaugurated to guide this process has successfully completed a comprehensive policy document dealing the operational and management framework of the fund. Secondly, the draft bill for the establishment of the Mahama Care Fund is now ready and will be submitted to Parliament immediately after the recess. Most importantly, that's the primary obstacle. The capping of the National Health Insurance Fund has been removed. This significant development has unlocked substantial resources, ensuring that a dedicated allocation of funds will now support the full-scale operation of the Mahama. These developments demonstrate our seriousness of purpose and commitment to the health and well-being of the Ghanaian people. As Minister for Health, I take this opportunity to call on all heads of agencies under my ministry, along with all collaborating institutions whose mandates are critical to the successful implementation of the Ghana Medical Trust Fund, to offer their full support and collaborate closely with the Ministry of Health. Together, we can ensure the successful realization of this transformative, life-changing initiative. Ladies and gentlemen, as I conclude, allow me to express my heartfelt gratitude to His Excellency John Dramani Mahama for entrusting me with the honor of facilitating the design and implementation of this groundbreaking health initiative. I remain optimistic that the people of Ghana, and indeed future generations, will cherish and appreciate the immense impact of this remarkable legacy. I also wish to express my sincere gratitude to the task force under the distinguished chairmanship of Reverend Professor Emeritus Seth Aidi, and to all the technical experts whose invaluable expertise made the design of this sustainable trust fund possible. Further appreciation goes to the drafters of the bill and the dedicated staff of my ministry who worked tirelessly towards the realization of this visionary project. Finally, I extend my deepest thanks to the many Ghanaians who voluntarily participated in the national survey and expressed their unwavering support for this life-changing initiative. Your voices have been instrumental, and I assure you that we remain fully committed to serving you with dedication, placing your needs at the very heart of our efforts. On this note, I leave you with these words, and I quote: "When we invest in NCD financing today, we ensure a healthier and wealthier tomorrow." Your Excellency, at this point, permit me to invite Professor Seth Aite to give a very brief remark. Thank you.
Your Excellency, President John Dramani Mahama, my very good friend, distinguished ladies and gentlemen, members of the task force, I deem it a great honor to be asked to speak on this historic occasion. The Honorable Minister has already summarized our report. You will find data, you will find graphs that tell about the suffering of so many people. But what you will not find in that report are the stories of these people who have been captured as data. People who are broken, whose homes are shattered. These stories broke our hearts. These stories touch us deeply. And I know His Excellency the President will move from resetting our minds to resetting our hearts through this initiative. As a task force, on many occasions as we heard the stories of patients who are suffering through chronic diseases, we wept. Our hearts were moved, we wept. Our hearts were broken by the state of their lives. And we wanted to do everything we could to help. We also wanted to mobilize as many Ghanaians as possible to support His Excellency the President. It's a story that I'll share with you to end my brief remarks. And this is a story which is referred to as the starfish story. Some of you may have heard about it. In this story, a storm had washed ashore thousands of starfish. And there was a young lady, young girl, who walked the beach and would find a starfish and throw it back into the ocean. Many watched her in amazement. An old man who saw this lady called her and wondered why she was doing that, because there are thousands and thousands of starfish and she wouldn't be able to save them all. Then this young girl, getting discouraged, bent down and took another starfish and threw it into the ocean and said, "This one counts." And soon the old man joined her. And then all those who were looking on also joined. And before long, they had moved all the starfish back into the ocean. Your Excellency, God has used you as an instrument to move or begin to move the hearts of Ghanaians and friends of Ghana and your friends and families to give and give and give and give, so that every single person with a chronic disease will rejoice, will have hope. We can save as many of them as possible so that they can get back to work. In Exodus chapter 2 verse 9, something significant happened. Moses, who had been put on Nile in a basket, was seen by Pharaoh's daughter. And then, to cut a long story short, Pharaoh's daughter wanted a nurse to look after this baby for her. And Mariam, a sister of Mary, went and called Jochebed, the mother of Moses. And when Jochebed came, Pharaoh's daughter said to her, "Take this child and nurse him for me, and I'll give you your wages." Your Excellency, you entrusted to us this beautiful baby that you birthed. And we have nursed that baby for you. We are not asking for wages. Rather, as chair of the task force, on behalf of my family, myself, we are presenting an adoring gift.
Wow. Wow.
A cooking gift to you. be the beginning of greater things to come. The God is unleashing Ghana. May we all obey the command of our Lord Jesus Christ. And he said, "This is my command, love one another. Greater love has no man than this, that a man lay down his life for his friends." John 15:12 and 13. On this note, Your Excellency, I humbly ask that members of the task force stand. I think some of them are right. Please stand. And I could sleep soundly because they were there to work morning, afternoon, and evening, and midnight. Thank you all very much. God bless you.
I think we ought to give the task force a round of applause. And then also thank CSOs, members of the Parliament Select Committee on Health. Also, we are told you did a good job on this. We also have members of the Ministry of Health, the Ghana Health Service, amongst others. And of course, I must also say that we are live everywhere. Ketsi, the Minister in charge of Government Communications, Felix Kwashiorfor, is also in our midst. At this point, we'd like to take remarks, brief remarks from carefully selected groupings. We will take, first off, from Professor Richard Adanu. He is a rector, Ghana College of Physicians and Surgeons. Please, let's welcome him.
Your Excellency, President of Ghana, John Dramani Mahama, the Honorable Minister of Health, Minta Kando, observing all the protocols that have been well established by the Minister of Health, I thank the organizers of this gathering, this historic event, for asking me to speak briefly. I'm here on behalf of the heads of agencies of the Ministry of Health, and especially on behalf of the rectors of the postgraduate specialist training colleges, to say that just like Reverend Professor Ite said, His Excellency has brought the baby out. He's created the legal environment for this Mahama Cares initiative, and the task now falls on us as heads of the agencies of the Ministry of Health to make sure that this works. So I'm here to say on behalf of all the heads of agencies that we are committed to making sure that this Mahama Cares initiative works and that Ghanaians feel the full benefit of this. I'm here especially representing the postgraduate medical colleges as we talk about this, because for this initiative to work, we need specialists to provide the leadership. And many people appreciate the work of specialist doctors and talk about that. But many of us are a bit blind to what specialist nurses and specialist pharmacists do. But then I'd like to just let all of us know that we need specialist nurses, we need specialist pharmacists, and we need specialist doctors to make sure that this is delivered. This is not a thing that is done only by doctors, it's done by the whole healthcare force. And whatever is being done to make this initiative work should not selectively choose some members of the healthcare force. It should cover everybody equally. Having said that, I'll talk about what I know. We at the Ghana College of Physicians and Surgeons have done some analysis, and we've realized that we need about 6,500 additional specialists for us to be, of all categories, for us to be able to deliver the kind of care that is needed by 2030. Currently, we have about 2,000 specialists in training in the country. So there's quite a bit of a gap. However, we can, mathematically, we can actually halve this gap if all regional hospitals in the country are fully delivering postgraduate training. And would like, Your Excellency, now that we have your ear, to ask you to lean on the Minister, lean on the Minister of Finance, and all other people involved to make sure that this is delivered during Mahama Chapter 2. We believe that it is possible in 4 years to have all the regional hospitals fully delivering a certain set of postgraduate programs. And if we do that, we can increase the number of specialists in training currently from 2,000 to 3,000. I mean, that's a 50% increase, and that would be very good. We would like to have all hospitals equipped with mini simulation centers. I mean, in other words, labs where they can go and practice on how to deliver their services and not necessarily practice straight on patients. And then, in addition to that, have 4 simulation centers over the whole country. We currently have 2. There's one here at UGMC, there's one at University of Health and Allied Sciences. And if we deliver 2 more, Your Excellency, we will fill this country with specialists. So I end by asking for the support of your government and your office to get this to happen. And have no doubt at all, we are fully committed to delivering this initiative. You have created the appropriate legal environment, and we are committed to working on this. Thank you.
Thank you very much, Professor Adoni. At this point, I would like to invite Corporate Ghana, of course, because of their immense contribution that we're expecting from them. I think that this applause should be actually bring down the roof at this point. Please, ladies and gentlemen, let's welcome the corporate banking head for Cal Bank, Kwejo Arize. He will be actually speaking on behalf of Corporate Ghana. Kwejo Arize, please, let's do it once again for him.
Good morning, Your Excellency. Good morning. Good morning, our Minister of Health, and good morning, ladies and gentlemen. Good morning. All protocol is observed based on what's been said already. So I stand here representing Corporate Ghana, and we work with people. And I indicated that everybody here is an employee, with our chief employee sitting. And if we don't take care of our people, we think that we're not going to be able to achieve our objectives as Corporate Ghana. This morning, I just want to draw the attention of Corporate Ghana to the need to support a healthcare that ensures that our objectives as an institution, whether in mining, in finance, in healthcare, in oil and gas, in whichever sector, is achieved. We can achieve that through working with people and ensuring that our people have good healthcare. We believe that the Ghana Medical Trust Fund is the right thing to support. It's the right policy to support. And we employing every corporate head, every institution to ensure we come to the party. This is not a one-time support requirement. This is supposed to be a lifelong activity that we all commit to. We can make it work if we all put our hands to the wheel. So I'm here calling on the support of all Corporate Ghana and everybody, every institution in and out of the country to put our hands to this to make it work. And I believe that with our over 14 million workforce from formal sectors, informal sectors, if we support this health policy, we can get the benefits and the country will be a much wealthy country with a healthy people. Thank you.
Group Head, Corporate Corporate Banking, Kujarawiza, thank you. And I see leadership of MTN here as well, so I'm sure that you're also committing to this. And if the applause you gave earlier for Kujo was not good enough, I'm sure you know it was not. It's time to hear from our development partners. And this time, I promise you're going to do it louder for them. Please, let's welcome the sector lead of the development partners in Ghana, the Chief of Health, UNICEF, Manuel DeWiz. Is that all we can
do? Your Excellency, the President of the Republic of Ghana, John Dramani Mahama, Honorable Minister, heads of agencies and directors, members of Parliament, distinguished guests, I'm standing on existing protocols. On behalf of the Health Development Partners, allow me to congratulate the Presidency, the government, and the Ministry of Health on the launch of the Ghana Medical Trust Fund initiative, a visionary step towards equitable healthcare and sustainable financing for the fight against non-communicable diseases. This initiative is in line with the vision of most health development services, including for NCDs. As you know, NCDs are a major public health challenge that undermines social and economic development and can increase inequities within populations. Today, as mentioned by the Honorable Minister, NCDs are the leading cause of deaths worldwide. Low and middle income countries are also affected. In Ghana, the share of NCDs in the disease burden is increasing, and this is mainly due to an aging population, rapid urbanization, and changing lifestyles. Most premature deaths from NCDs are largely preventable. Through the development of multi-sectoral public policies beyond the health sector to prevent exposure to key risk factors such as tobacco and alcohol abuse, and healthy diets and physical activity. Furthermore, there is a lot of evidence that supports the implementation of cost-effective preventive and curative intervention in health services. Strong leadership and urgent action are required to achieve this, and we commend the government and the Ministry of Health for their leadership. However, as always, sustainable financing remains a major challenge and requires innovative thinking, and we commend the uncapping of the NHIL for this purpose. The remarks by the Honorable Minister unveil important features about this important initiative, but we look forward to learning more. Health Development Partners stand ready to provide the necessary support to the Ministry of Health and its agencies to help save lives, improve the health of present and future generations, and ensure that the human, social, and financial burden of NCDs does not undermine the development progress made in Ghana in recent years. Thank you and congratulations once again for this transformative initiative.
Thank you, Manuel DeWiz. Of course, if you mention MTN, you must mention Telecel. They are also represented here as well. At this point, it's time to bring it a bit more home. When we talk about chronic diseases, many think that it is associated with just the aged. But nowadays, more and more young persons are finding themselves hit with this particular situation. Most of them have been driven to poverty as a result of the situation. I have in our midst this morning a mother and a daughter who are both living with diabetes. Ladies and gentlemen, it's time to hear the story of Janet Ashibo. Please welcome her with a round of applause.
Mema Michia President Mahama, any the children for you any penny for you now, Damasi Chiam. I don't find so. I am a lady, and Emma who was a Miss Mijinaha. Me a diabetic patient. And me be tremble. You say a penny for Yanri, and I'm your musica, only Swati, and only as I am. but menim say ade a yare a ebetima ba nkola mu susu minya eno ache kakra ba me protect me kakra say me betina se ache